In this video, I want to describe what to expect on the day of your parotid surgery. On the day of your parotid surgery, you'll report to the hospital or surgical center where your procedure is scheduled. You'll check in, and then you'll be directed to the preoperative holding area. There, a nurse will greet you, review your general health history, ask about allergies, go over your medications, and place an IV. That IV is used to give fluids and medications before, during, and after surgery. Next, your surgeon will come visit with you. You'll review the surgical plan, confirm which side you're operating on, and typically mark that side with a pen. You'll also have time to ask any questions. Then your anesthesia provider will meet with you as well. They'll discuss the anesthesia plan, what to expect as you fall asleep and wake up. After that, you'll be taken back to the operating room. You'll move yourself over to the operating table, get positioned comfortably, and you'll breathe some oxygen. Then medications will be given through the IV, and you'll fall asleep. Once you're asleep, the anesthesia provider will protect your airway. This is typically done with either an endotracheal tube, which passes through the vocal cords, or a laryngeal mask airway, which sits above the voice box. Your anesthesiologist will discuss what's most appropriate for you before surgery. After your airway is protected, your face and neck is cleaned with a sterile solution. You'll then be covered with sterile towels and drapes. For parotid surgery, we also commonly use facial nerve monitoring. This involves placing small electrodes near the eyebrow, around the lip, and sometimes along the cheek as well. The goal is to help identify and protect the facial nerve throughout surgery. After the surgery is complete, the incision is closed in layers using dissolvable sutures underneath the skin. The skin itself may be closed with surgical glue and/or sterile strips, depending on your surgeon's preference. When the procedure is finished, the anesthesia team will wake you up, remove the breathing tube when it's safe, and your vital signs are stable. You'll then be taken to the recovery room. While you're in recovery, your surgeon will speak with your family and explain how the surgery went, what was found, and what to expect during the recovery period. In the recovery area, the nursing staff will monitor you as you wake up fully from anesthesia. Once you're awake and stable, you'll be reunited with your family. At that point, you'll have a chance to ask questions, and you'll be sent home with written post-operative instructions. In some cases, you may go home with a drain. This is a small tube that exits through a separate tiny incision below the main incision line. The drain helps remove any fluid that collects after surgery. The nursing staff will show you how to care for it, how to measure output, and confirm you feel comfortable managing it before you go home. From a pain standpoint, parotid surgery is often not as painful as people expect. We typically inject numbing medication in the area, which helps quite a bit early on. Ice packs over the incision area can be very helpful for the first 24 to 48 hours. Most patients do well using medications like ibuprofen and Tylenol alone. Occasionally, your surgeon may prescribe a small amount of a stronger pain medication to use if needed as well. And that's what to expect on the day of your parotid surgery. So now you knows. Thanks for watching.